here to get feedback and input on the Resource Guide and Toolkit for Sustainable Impact in Antimicrobial Resistance Projects. And this is crucial because antimicrobial resistance is one of the biggest global health threats that is out there at the moment. The majority of the mortality is coming from sub-Saharan Africa. And this is a disease which is currently causing more deaths than TB, malaria, and HIV combined. However, unfortunately, AMR is a silent pandemic. It's not something which is easy to see or appreciate, but it's a massive problem. And as we all know, the current fiscal situation in terms of availability of funding and resources for public health and global health issues is not very much. So it becomes even more important to ensure that the little resources that we have, whether these are funds, whether these are human resources, are put to the best use.
So this AMR sustainability workshop has been very useful. I asked the question during the workshop that why didn't they come earlier? The workshop makes you think about or shows you where you could put things in place to be able to sustain the project after the project is done. So example, it asks you questions. Who takes over? Have you put things in place as to how the facility takes over? Have you put things in place as to when the facility takes over the project? So those are questions that we asked that if we had known earlier, we could have factored them in our projects. I mean, there's quite a number of things that we put in that we thought was sustainable, but this workshop obviously draws your attention to the nitty-gritty that it could have put in to make it more sustainable.
Project couldn't be more spot on because we've been working on antimicrobial resistance for a long time, ranging from developing national action plans, implementing various activities on AMR, both at the regional, local and global phase. The change in the health landscape, the funding reduction, the changes in funding, the changes in stakeholder engagement on AMR, and how sustainability of this project will come up. This project is very, very important to really address what sustainability looks like in a context-specific situation in Africa, in the countries this project is working in, and see how we can really develop a guide that is usable for people working on AMR, on this project and beyond. So it's very, very important. I think all the global discussions now is on sustainability, and we need to really think from a sustainable mindset from the beginning. We can't afford to have sustainability as an afterthought. This has really made us think with the changes happening globally that we need to embed sustainability from the beginning of any project and think of the exit and what that looks like. What does the legacy of sustainability look like? So this is very important that it's context specific. For Ghana, what does this mean? We're discussing at the time in 5 years' time in 2030, and this project is sustained. What does this mean? So that question is very critical. Does 10 years mean it's sustainable? Does it mean when it is embedded in your policies and your processes, what does it actually mean? So this is something that there's no one size fits all, and it's very important that it comes from what is happening in country. So, but very important question to set our minds thinking in this workshop. Thank you.
Yes, this workshop and the whole project to develop a sustainable impact guide and toolkit is very important to ICARS. One of the core principles of ICARS is to develop sustainable solutions that should outlast the lifetime of the project and have lasting impact in the areas that we want. So since inception of ICARS, that has been a core function and requirement for all our projects to have a sustainable plan, but we had not systematically worked through it, and we didn't have a systematic way to guide projects as they work on the sustainability for their projects. So I think this is a very important undertaking for ICARS, and now we'll have a guide and toolkit that can guide projects as they implement, they have sustainability in mind from inception.
Because the development is based on scientific dimensions, so we need to test run to be sure that the toolkit we have developed is actually workable, applicable, and useful to different projects on AMR in different countries, and having the capacity to be used either in the beginning or in the mid or late end at the exit point. And it must also cut across different sectors so that it can be universally applied.
I mean, over the last couple of years or even up to a decade, and most recently this year, there have been conversations around sustainability. And particularly for this year, when there's been challenges or limitations in funding, the funding landscape has changed drastically compared to how it used to be. So there have been growing conversations around the fact that while we're having many interventions in AMR and even in health and development space, how do we sustain these projects and ensure that even after funding ceases, how do we ensure that these projects are sustained, particularly in low and middle income countries, LMICs? With the work that has been done by different organizations, particularly ICARS on AMR, who ICARS currently works in about over 20-something countries. So there's a growing need to really, bring out the area of sustainability to ensure that all the work that has been done in the last decades or more does not just end abruptly. And particularly LMICs are able to sustain their work internally with support from external partners when and if available, but to ensure that projects, interventions are being sustained within the countries where they are being implemented. So that's the reason for this project, and then of course this workshop. Just to give a brief run through the objectives, we wanted to introduce and receive feedback on the toolkit for integrating sustainability in AMR interventions. We also wanted to test and receive feedback on the tools for use across the project cycle, from planning and implementation to institutionalization and exit. And also to receive feedback, validate and evaluate understanding of the elements of sustainable impact. And then we wanted to facilitate knowledge sharing across project teams on practical strategies to embed sustainability into AMR programs. And then lastly, we wanted to co-create improvements to the tools and frameworks through live testing, stakeholder discussions, and collaborative learning.
Yes, so this workshop is very, very, very useful because it's about using a tool to assess the sustainability of our intervention in the area of AMR. So this AMR sustainability toolkit that we went through for the past 2 days is very, very important because it's going to make this toolkit available to us, not only to Ghana, other countries, so that we can use them for any intervention we are doing in AMR, in One Health, for animal health, human health, and the environment. There's this knowledge gained from this workshop will assist me to assess any intervention, either in human health, animal health, the environment, on the sustainability of the intervention. A lot of time, a lot of projects, the moment the funding is over, that's the end of the intervention. But with this toolkit, it helps you, guide you how to even fashion out the intervention from the beginning, in the middle of the implementation, and especially at the end of the implementation of the intervention, so that you can have useful recommendation for rollout.
This workshop has been very useful, I should say. It has made me understand the various challenges and then how to be able to improve on those challenges to make sure that we have a sustainable environment, especially with antimicrobial use and resistance and the whole AMS policies that we've initiated in our facilities. Made me acknowledge how important it is for us to work as a team to ensure that there are no knowledge gaps when we lose members, a whole lot. So I think it has been very useful. Personally, I came here on behalf of my institution. So I feel when I go back, I need to also update my colleagues and train them on the various tools that we used in our survey to ensure that we have a sustainable program, especially when it comes to antimicrobial stewardship in the facility.
I feel very fulfilled. So maybe just to let you know, this has happened in Kenya last week. We had to have back-to-back workshops for this. And looking at what we've done in Kenya for the workshop in evaluating the tools and the resources that are developed for projects to be able to integrate sustainability into their projects. I think I would say I'm very fulfilled with the work that we have done. I'm very happy with the responses and feedback on the use of the tools, on the relevance of the tools to each of the team's project, particularly in Ghana also. I'm very happy with how people have said, why haven't we had this earlier? Why are you just coming now? And I think it just shows to see the relevance of how much people really need this kind of framework or tool for sustainability, and how important it is for, even though people externally are concerned, but even internally in the LMICs, we are all concerned about sustainability. And it shows how much is a very integral part of our project. So I'm happy with the feedback so far. I'm happy with the coordination process, the collaboration between our team and also the country teams has been really seamless. I think that everybody has been really cooperative and invested in seeing the outcomes of the workshop and ensure that it's a positive outcome and we have the best feedback possible to be able to have a final, developed tool for the world globally.
On behalf of the Ministry of Health and the partners in the ICARS projects, I declare this workshop on OMR Sustainability Toolkits, a resource guide, duly closed.